Dentistry and General Radio Network presents
the Independent Dental Practice Podcast with Dr. Sonny Spera. In this episode,
welcome to the Independent Dental Practice. It's Dr. Sonny Spera. Today, my guest is a hoot, Dr. Sabrina O'Shee. She has the it factor and she has the passion in her veins for what she does. She comes from generational dentists. She's the third. Grandfather, father, and her whole family worked in the office. And we just talk about what it takes to own a practice and what you should be doing if you're having any doubts or any questions. If you like the show, please click like, share it with your friends, subscribe, watch us on YouTube or the DIGRN, Dig Radio Network, courtesy of Bob D and the folks at Dentistry in General. If you don't like it, you better tell me about it. Dr. Sonny Spera, please reach me at sonnyspera@gmail.com, Sonny with an O, or independentdentalpractice@gmail.com. Or you can call or text me, 607-624-2962. That's my personal cell. Love to hear from you. If you want to come on the show or you got some great ideas, love to have you. Have a great day, everybody. Thanks for listening.
Dr. Sabrina O'Shee, her journey to practice ownership, a discussion with Dr. Sonny Spera.
Welcome to the Independent Dental Practice, Dr. Sonny Spera. Today, my guest, Dr. Sabrina O'Shee, who is a third-generation dentist from Baton Rouge, Louisiana. She's a graduate of Louisiana State University School of Dentistry and has been in practice for 7 years. I got a feeling she knows how to cook crawfish. I'm just going to take a guess. Her grandfather and father were both practicing dentists, and Dr. O'Shee had the opportunity to work with her father for 4 years before his retirement at the family practice, Portwood Dental. Before his retirement, Dr. O'Shee purchased the practice and has been in ownership since. Dr. Sabrina and her husband, Seth, are both dentists that own separate practices. However, they assist each other with procedures and at each other's offices frequently. Dr. Sabrina has a focus on orofacial pain, trigger point injections, headaches, migraines, facial aesthetics, musculoskeletal disorders of the head and neck, and TMD, temporomandibular dysfunction. In her personal time, she spends most of her free time with her husband and her dog, Max. They are the loves of her life. Welcome, Sabrina. How are you?
Hi, I think my dog is having a change of opinion on being the love of my life right now. He's outside and crying.
He was part of our conversation for the first couple minutes. But tell me what it's like growing up with a lot of dentists and a lot of people. I bet you the dinner table had nothing but dental conversations.
That was it. It was always dental talk. It was always work, always dental talk. I started working in the office from the time I was 16 till now, till current. That resume says ongoing, current. That dash just keeps going. I started front desk and then went to chairside assisting and just always talk teeth.
I got to believe what I just read is part of your practice. The mainstays of your practice has to be a little bit different than what your father was doing.
It is. I still have staff members from when my father practiced, and we still do practice the way that my father practiced, and we still have a lot of the ways that my father practiced. We still believe the way that my father practiced. There are a few things that have changed. One of the big things that's changed is that we have less family at the office. That was big. That was huge. And I know I'm not the only one in the world that has a lot of family working together, but I know that I might be one of the few people that have had it, that has had it ended so disastrously. And
I got you. But yeah. The point is, though, the philosophy of the practice, like, for example, if you came into our practice, okay, we don't do a lot of those procedures in those areas.
Yeah.
And if the practice was yours, you would want to move into that area or certainly highlight that area, make that a mainstay of your practice. So I was just thinking if I'm old traditional practice and I have a doctor that's in with us that wants to do some of these things, A, yeah, we're going to support her. B, we're going to have to get educated on some of the levels of what they're doing. When you're talking about doing, excuse me, let me read it exactly. Trigger point injections and orofacial pain. That's way more than I got a toothache, doc, or I woke up with a headache. It's a little more involved. How did you get into that, first of all?
So I started doing that. I learned first how to treat temporomandibular dysfunction from my dad. He's the one who first got me interested in it by learning how to make a good splint. He has always made a good splint. He's always taught me the foundations of making a really good splint.
Okay, so he had a pretty good amount of background in that. That's good.
I did. And that's where it ended there. It was splints are beginning, and that's it. If
Right.
it doesn't fix your problem, then there's nothing else I can do for you. And once I got out and started practicing, I was like, there's got to be more to this. As a chronic migraine sufferer, I knew there was more to this. Like I've had
You have a healthy
TMJ
curiosity.
issues. I do. We're all scientists here. We all have healthy curiosities. We all want to
Right.
know why.
And living with, that's it, I can't do anything else, that's almost goes against everything we've learned.
Yeah. So I went to the American Academy of Facial Aesthetics and I learned how to inject Botox. I learned where to inject Botox. I learned how to dose out, I should say botulinum toxin because my favorite brand is DMN personally. But it's a great therapeutic. And I have this conversation with patients daily about what a great therapeutic it is because I get the looks from patients all the time. I don't want to look like that. I don't want to look frozen. And I said, you won't, I promise. You promise you won't. I said, it's a therapeutic and we're going to go into very targeted areas to help relieve very specific muscles. And learning how to do that really opened my eyes and really helped me change my career trajectory. It really did.
Well, correlated to a tooth, you come in with a tooth problem. If you fix the tooth, you fix the problem.
Not necessarily.
But many times it is. But
Many times.
in this scenario, they're having a problem and you're identifying and you're treating the trigger, the source, right? So to me, there's a correlation that I think can be made, and I'm probably doing a horrible job at it, but I think you can make a correlation that get people to understand the therapeutic understanding of what you're talking about. Yeah.
Yeah. How many times do you have an upper premolar that you do endotherapy on because it's a hot tooth? One, you can't get it to calm down. It's testing as SIPSAP. You can't get it to calm down. It needs a root canal. It needs endo treatment. Stat. We need to do this today so this patient can sleep. And then you do the endo treatment and it doesn't calm down. It's most likely coming from a muscle that's inflamed somewhere towards the back of the head or even towards the top of the head in the temporalis, maybe occipitalis. And if you take even just a needle with a little bit of plain lidocaine, you might be able to find that spot and relieve it. And that patient's symptoms can go away. It's incredible without having to go and do, I don't want to say the trauma, but endo treatment's traumatic for a tooth. Endo treatment's traumatic for a patient. If we can just do one small injection and help a patient, that's amazing. It's incredible. Well,
that has to really lend itself to a tremendous referral base because one of the greatest things we do is get people out of pain.
It's hard to change a mindset because we've been taught one way of how tooth's in pain. This is how we treat it. It's hard to teach a new way of how we can treat this tooth. It's a work in progress for sure. But I think that
but the patient's receiving these, that's a direct benefit. That's a tangible, hands-on benefit.
They think it's magic.
Yeah. So if you're the magician, I want to tell everybody about this magical dentist. You got a toothache, go see her.
Yeah. Talk about trigeminal neuralgia. Trigeminal neuralgia is now being treated by botulinum toxin. It's great. It's incredible. But that's what started me on this whole trajectory of orofacial pain and doing that in my practice.
So where did you get most of your training?
American Academy of Facial Aesthetics. I also did a mini residency at the University of Kentucky with Dr. Okasan and Dr. Isabel Moreno-Hay. They are phenomenal up there. They are absolutely incredible instructors. They have a great orofacial pain course. If anybody is ever interested in deep diving into this, they not only go into the pain, they go into the psychology of it. They go into sleep, which is so tied into pain. They go into the neurology of it. They go into the structure of the skeletal system. They are so smart. They're great. They're so good.
How many dentists in your area practice this?
We have one orofacial pain specialist, Glenn Kidder, who has been practicing orofacial pain for many years now. And it's funny, he actually was a roommate of my dad's in dental school. And so I've known Dr. Kidder for a long time, but he's been doing it for a while. He doesn't like to do the injections. He does not like to inject. He does a lot of equilibrations and a lot of splint therapy. I found to be a newer technique, a newer way of doing things. I'm not an orofacial pain specialist. I am not. I am a general dentist who enjoys orofacial pain.
Think of what happens when you have a little more skills, you have a little more moxie behind those skills, and you have a little better diagnosis because you know that your treatment plan. So now your confidence is going to be perceived by the patient just as terms of accepting treatment plans. As you develop some of these skills, you have that little more confidence. So where did you go to dental school?
I went to Louisiana State University in New Orleans.
We visited there, and we had a great visit. The person that took my son and I around, he was great. He says, one thing we do at LSU, we're going to get you ready clinically. They hung their hat on and said, you will be clinically ready when you graduate. Do you experience that?
I do agree with that. You know, I've seen clinicians from elsewhere in other schools, and I've worked with clinicians from other schools, and I can tell the difference. I can see the difference. I can tell an LSU grad from someone from elsewhere. I really can. They'll get you into clinic earlier. They really will. They've been through a little bit of turbulence the last few years with trying to land a dean, but we've now got John Gallo as our dean. He was an internal hire, and I think he's going to do a great job. But I think we've got a good future ahead of us there. Hopefully the turbulence is behind us, and it can grow from there. They're going to get you in there early. They're going to get you in there second year working on a patient, and they're going to get you all third year, all fourth year. You're going to be ready.
Yeah, he was clear about that, and we had an enjoyable time. So in your dental school experience, being that you have really only one set of kind of reference points, being that you grew up in the family and the environment that you did, what were some areas that you picked up in dental school? You said, hey, what about this? What about that? What were some things that piqued your curiosity more?
It was so heavy on restorative that there really wasn't much else that piqued my curiosity.
Aesthetics restorative or just restorative?
It really was mostly restorative. There wasn't we had a few courses on like aesthetic restorative, veneers, things like that, aesthetic composites, but there was never a heavy course load on it. It was basically the bread and butter. And I'll always tell any of the graduates, you got to get out. You got to do your courses. You got to go to CE. Like my husband, Seth, and I, we're CE junkies. We love going to CE. We love traveling for it. We will go to all sorts of CE. We will go and take CE all over the place.
What's his practice look like? What's the dynamics of his practice?
He's more of a bread and butter dentist with restorative, a little bit fixed pros, and he has been doing a lot more implant dentistry in there as well these last few years, and he's been doing amazing at it. He's been doing really great at it. It's been growing. He just opened his practice from the ground up a couple of years ago after moving around a bit as an associate. He moved 3 times as an associate and never found a good home that fit his ethical code that he believed in, that how the patient should be treated. It just never lined up with anybody. And he was like, you know what, if it's not lining up with anybody, I'm going to do it myself. So he did it himself. And that's...
He started from scratch?
He started it from scratch. And it's a hard road.
Yeah. How much out of dental school did he do that?
5 years.
Wow. So he had to learn. You said he worked in some corporate situation, right? He had to learn what he wanted to do, what he didn't want to do. He had to really fine tune it. Did he have that moment where he said, that's it, this is what I'm doing, and I'm going to have it exactly the way I want it, like an epiphany?
I wouldn't say it was an epiphany. It was very much a gradual thing, because there would be days he'd come back from work and he was just almost burnt out. He shouldn't be 3 years out of school almost burnt out. It's right. It's too much.
Nope.
He was just running to the ground. He was seeing too many patients. He was doing too many procedures, and he had too many people over him breathing down his neck to do too many things that he didn't think should be done. And
Right, but his practice and his journey is a lot different than yours. You're in
oh yeah,
what seems like a pretty set lane, right?
it is. It's a bit different because I've had a few health issues that have pushed me into a smaller lane to where I can't do I can't do the extractions. I can't sit and do endo forever. I can't sit for an hour and a half and file each canal. I can't do it, but I can sit and treat your pain. I can do that. And I can sit and have a conversation with you about your pain. But our routes have looked extremely different, and that's how we can balance each other out and we can help each other out for sure. And we have definitely helped each other out with each other's practices. He comes
So when he starts from scratch, though, he's probably got a lot of marketing and a lot of tips so that when you take over the practice that's going to be yours, you'll help. Now, let me ask you this transition for yourself. Was the business side of your interaction and your transaction with your father, was that laid out smooth, or were there a bunch of things not really spelled out?
We had a buy-sell agreement. We had a broker come in, and so that it was very fair. Now, there was one thing. So I bought the practice right after COVID, and the broker told me privately I would have the practice revalued because the value had gone down. I told her, I said, I can't do it. It would have crushed my dad.
Yeah, but you're also thinking, listen, we had a deal. You're not going to take advantage. You're not going to be opportunistic per se.
That's what it felt like. It felt like
I don't disagree, because I've had people on the show when I was doing the Fee for Service Group podcast. Same thing happened, and they honored what they were going to pay, and they bought a practice, etc. In the end, it's probably not going to be significant. I don't think the dollar difference, but the difference in your integrity through something like this is there's no price on that.
No.
Okay. How did that transition look from a business standpoint once you bought it?
Going back to what we just said, like when it comes to family, you have to go by the book. That's just my last statement on doing the whole, like, get the broker, get the contract, get the buy-sell agreement, get everything. Like, you have to go. You can't have just a handshake and a check passing hand. You can't do it. You got to do it by the book. You have to do it legally. You have to have all of your ducks in a row because it's going to come back to bite you. But anyway, so I had at that point worked at the practice. I had worked there before I was in dental school. I had worked there since I was in dental school. A lot of the patients knew me, so we had an easier time with transitioning because a lot of the patients were a lot more familiar with me. So we did not lose as many patients during our transition. Now, as far as my father's retirement process, he started to pull back. He actually had a double knee replacement about 6 months after I purchased. And then I actually had a spinal fusion. And so we were tit for tat on major surgeries. We were both out of the office. We were both taking care of the office. And it was nice having the security, though, of having the purchase taken care of while I was out of the office. That was actually really nice, having a little bit of security for me. It was nice. Yeah. If I didn't own that practice, I'd have been sunk.
It goes to show you there are business things that are done for a reason. And sometimes we may not understand it, but there's a reason why they're being done. When did you take over the business functions, the bills, the insurance, the accounts receivable? When did you take over those things?
Immediately, 5 years ago.
How did you deal with the people that want to just continue going to the former owner and not come to you?
It's fine. He was still there. He was still a practicing dentist there. But we did tell the patients that he's only here a day or two a week. If you want to come and see him, you're going to have to come on Tuesday mornings. You're going to have to come on Thursday mornings. That's the only time he's here.
Let's say your dental assistant does something and you're like, hey, listen, you got to be here at 8 o'clock. You can't come in at 8:05. And she goes to your dad.
Oh, I had no issues with my staff with that. They were
That's beautiful.
Phenomenal with coming to me. I know it is, but I think it has more to do with my staff than it does with me.
What were some things that you wanted to do?
It's hard. At that point, I really held back a lot of the things that I wanted to do because I wanted to have a lot of respect for my dad. I didn't want to change the things that he had built at that point. And so I just didn't change them into what I wanted.
So is your dad still practicing a day a week now, or what is it?
He's done completely. As of in July, it'll be 3 years, but he's fully retired at this point.
So did you wait until July of 2022 to say, hey, these are some things that we're going to, what were some things that you did? In 3 years now, has the practice grown for you? What's it look like?
The practice has grown into, we offer a lot of different procedures. The biggest thing we offered was clear aligners. I know that sounds so silly, but we offered clear aligners. And I remember when we started offering them, and my sister looked at me and she was just like, I didn't think we were going to be one of those practices. And it hurt so much. Exactly. It's hurtful to hear because it's like, what do you mean one of those practices? Like,
you can write it one way, but how you say it, that's like a Seinfeld thing. What was the emphasis on?
Those practices. It hurt to hear that because it was all written there on her face in the way she said it, that she knew exactly what kind of boss I was going to be, what kind of owner I was going to be, what kind of dentist I was going to be. It was all there. And that was really hard to overcome. But I had to tell her, like, listen, this is an opportunity for our patients to have more treatment available to them here. Treatment that...
Yeah, there's no real downside if you think of it.
There's no downside. It's like patients are either going to have it done or they're not. They're either going to the orthodontist, going to the orthodontist, and they're either going to have it done or they're not.
They're going to have it done or they're not. That's exactly right. But you have the ability to. Why not?
It is, and we've had great luck with it, and we've had patients who are so thrilled that we offer it now. They're so excited. They're like, I didn't want to go to the orthodontist to have that done because I'm nervous that they're going to put me in metal brackets. I'm nervous about that. And it's, you don't have to be nervous. We're here to help you. This is just an option. We will tell you if we need something further, but let's at least talk about it. Let's have a conversation. That was a big thing with my sister. And that's why I always say, God, freaking boundaries. Ugh, you need the boundaries.
Well, you said now there's 2 doctors in the office. Who's the second doctor?
My husband right now. Right now he comes in. He has been amazing. Right now I'm going through, like I said, some health issues. I'm going through some diagnosis issues. I'm having some mobility issues. And he has been amazing with coming in right now and helping me with doing some of that bread and butter dentistry, some of that, the fillings, some of the crowns, some of the day-to-day dentistry that I need help with right now until I get an associate in this summer. I've signed my contract with her. She's amazing. She's a new grad coming out of LSU.
I was going to ask you, LSU grad, of course.
She's great. She's awesome. We met her through the LSU AGD group over there, which is incredible. Their AGD organization they have done so well with their student organization. And so she is starting this summer, and I am so excited. I feel relieved, honestly.
Okay, so let's talk in terms of ownership. What are some of the things that you think as an owner are non-negotiables in terms of how you practice? I know you said one thing, you're out of network. I know you said that.
That's true. That is true.
And you're not going back.
We have gone back and forth about it. I'm not in network with any insurances. And
the stuff you do may have to be covered, right? Or you'd have to go to medical plans, would you?
As of right now, yeah, we're able to get several things covered through our dental, and we're in between companies right now with our medical groups. They've been filing for us. I can't remember the name of the old one, but we've been hunting for new ones with filing for us with our medical. But yeah, it's.
So what are some things that are really important? Organized dentistry?
Oh, yes.
What do you think are really important things as a practice?
Oh my gosh, yes. Organized, you have to get involved. Like, you have to get involved.
Okay, now. I asked you this question a second ago.
Did you?
And you looked at me like, what are non-negotiables? That's a non-negotiable.
I'm sorry. I needed examples. I'm so sorry.
I don't want to lead my guess. I don't want to do that. How slightly suggestive. You took that ball and ran with it, though. Let me tell you.
Okay, so I'm
So you're
currently the
passionate about it. Talk
president
about it.
of our Louisiana AGD. We've been involved with our Louisiana ADA, and I love what Dentistry in General is doing. I love the stuff that Dentistry in General talks about. I
Bob's
think that
passionate about the political stuff.
I think it's great. I think that it needs to be talked about more because I think a lot of it is brushed under the rug and hidden. And I think it needs to be brought to the forefront because I think
he walks the walk. He doesn't just talk the talk. Let me tell you,
there needs to be more like him.
The amount of resolutions and stuff he's putting forward on behalf of dentists.
It's great.
Is unbelievable, unfathomable for me.
There are things that I had not heard of that are being brought forward that I find out from the Facebook feed from Dentistry in General. It's great. No, it's awesome. I'm so glad.
I'll toot Bob's horn all day long. He does a lot of things that people want done, but they're not willing to put the time and effort into it or put their name on it.
Now that's hard. It is very hard because I mean you're worried someone's going to come after you for it. And I mean, but
you know the Giraffe Society, right? Stick your neck out. You'd be part of the Giraffe Society.
It's hard, but I mean, it affects everybody. It affects all of us. It's going to affect us. Like I said, my dad was a dentist. How many of your kids are going to be in dentistry? Are you willing to do it for your kids? You willing to do it for grandkids? And so, I mean, who are you willing to do it for? Are you willing to do it for yourself? You just got to fight for what's right. If you're wanting to put it into other people's hands, it's never going to be what you want. You're never going to get what you want.
Let me ask you a couple of questions that we'll wrap it up here, okay?
Yeah.
You're talking to a room of 50 dentists in their first 5 years in practice, and they're looking for you for leadership and guidance and advice. What are some things that you would share with them that in your own life, professionally and personally, have been essential or so important that they need to know about?
Cut off at the end of the day. Find a way to turn off at the end of the day. If you're going home,
say that again. Cut off. So shut off. You need to shut down the dental.
You do. Of course, like my husband's a dentist. We talk dental. We talk teeth. Of course, we're going to talk
but
teeth.
if you practice in a small town, you ain't getting away from it.
No, but if you're going home and you're still talking teeth, something's wrong. You don't have a safe space. You don't have a space that's yours. You don't have a den. You don't have a cave that you can go to. Seth and I know if we say, I can't do anymore, that's it. We talk about something else, or we just get quiet and we turn on a show, read a book. We just play with the dog or something. That's it for the night. We don't talk anymore dental. That's it. That's it. But you have to turn off. You have got to turn off. You have
hit the off switch, hit the delete, hit the off. What else?
Get involved with local organizations. Get involved with your local AGD groups. Get involved with your local
dental society.
That's it. That's the ones. Local dental society.
I wasn't leading you. I can help you.
Words.
I can help you.
Get involved with your local CE groups. It's a great way to get your hours. If you've got a Spare club near you, if you've got Seattle clubs, if you've got whatever you've got near you, go ahead and get involved with them. It's going to be a great way to get your hours. It's going to be a great way to meet people. It's going to be a great way to catch up with your friends from school. Seth and I started a Spare group in our area. It's all our friends. We meet up with our friends once a month. It's great. And we keep getting recruits. We keep getting new people joining our group. And so we keep getting new friends. But it's awesome because they're all our friends from school. And it's awesome. But that's what I would recommend. Just get involved with whatever's going on in your area. Because like I said, it's an island. Get off the island.
Yep. Get out of the cave. That's what we used to call it in the old days, right?
Yeah, you got to.
And that's how a lot of the insurance companies dealt with the dentists. They knew they practiced primarily in solo doc shops, and they could come in and they could give you the fear of missing out. That if you don't join, down the street's going to join, you're going to be out of business. And they attacked it strictly from a fear factor. And fortunately, the dentists in my community, before I got here, made it important to educate the dentist into what that was and what that looked like, so that you can make an educated decision. So a lot of people didn't go into those networks, and that's how it worked. Now, the next question, last question I'm going to ask you, as a business owner, now, same scenario, you got a group of maybe 15, let's make it smaller, let's say about 10, 5 to 10 dentists. They're all in their first 10 years of practice, and they're all thinking about being a dental practice owner, but they're scared, they're nervous, they see all the work. They think that they can't handle, they don't have the bandwidth, they've got a million reasons that's going through their head, and a lot of it's fear. What's the conversation look like for you with those people?
It's 100% a scary thing to jump into. It really is. But the benefits that you get and what you get on the other side of it it's definitely worth it. I get to call my shots. I get to say what I get to practice. I would have never been able to say that I get to do orofacial pain in my practice almost exclusively if I didn't own my practice. My husband wouldn't get to say that he didn't want to do third molar extractions if he didn't own his practice, even though he keeps going back on that. But you have that freedom that you get to choose the life that you want to live. And so you don't get to do that as an associate. You don't get to do that with someone else calling your shots. So if you want to have the life you want to build, it's going to take work, but nothing comes easy. Nothing's easy.
If you want to have the life you want to build, says a mouthful, right? That says so much on so many levels. If you want to have the life you want to build, it's not going to happen working for someone else. Wow. Pretty powerful. If people want to reach you, Sabrina, how do they reach you?
They can reach me at my email. It's Dr. Spooshee, DRSPOOSHEE @gmail.com. They can also call me at 225-766-8278.
All right. Do you have a website they can reach you?
Yeah, they can reach me at www.portwooddental.com.
How do you say it?
PORTWOOD.
Portwood. There you go, folks. Thank you very much for spending some time and sharing your passion. I love your enthusiasm. I really do. It's infectious. And your team, whoever works with you, your husband, lucky to be around you. Well, I'm looking at you through Zoom. It comes through the Zoom, but if I'm listening to this, it jumps out of the speaker. So thank you very much for sharing. I would love to have you back on for a little update, maybe towards wintertime, and fill us in on how things are going and what's happening in your world again.
Sounds great. This was awesome.
Thank you so much.
Thank you.
Take care.
This has been a production of Dentistry in General Radio Network. Visit our website, dentistryingeneral.com, to join engaging clinical and business conversations, explore our dental podcasts, and stay updated on our upcoming live events.